That wonderful Tuesday that I entered the emergency department at Rush. I had worked all day. I was very tired. I had a meeting with the Westside Anchor Mission Employee Resource Group. And someone in the resource group was just very transparent about how they were feeling that day, which allowed me to be transparent about how I was feeling that day. When I got off of work, I was heading home, and one of the fellow council members, her name is Audrey, she gave me a call, and she said, "Chanel, you were on my mind, and I wanted to check on you." She heard how I was sounding in my breathing. I did not know how I was sounding, and I was going home to go to sleep. She strongly encouraged me to go to the emergency department. She said, "Chanel, you live alone. You don't want to die alone." And I said, "Okay, Miss Audrey, I am going to the emergency department."
She had recently had COVID infection, and unfortunately, several weeks later, had presented to our hospital with a major blood clot that had gone up to her lungs, and this caused her to have cardiac dysfunction and low oxygen levels, necessitating a hospital admission.
Every Rush professional that I encountered, they said, "Ms. Smith, it is very good that you came in today. If I would have gone home to go to sleep, I don't know if I would be here talking to you."
The Rush Pulmonary Embolism Response Team, it's a team made up of interventional cardiologists, radiologists, and cardiac surgeons, and we basically will treat and evaluate patients with pulmonary embolism and come up with the best treatment plan individualized to the patient.
It was like, 7 doctors. And I said, "You're all here for me?" And they said, "Yes." And it made me feel so good.
In Chanel's particular case, she was able to be considered for a minimally invasive technique where we're actually able to go up into the lung where the blood clot is and administer blood clot busting medication locally in that area over several hours to help dissolve it.
As soon as they are stable enough to come out of the intensive care unit, they're moved onto a hospitalist's care, onto the general medicine floors. Patients that nowadays are so sick that when they come into the hospital, oftentimes it isn't just one problem that they have. They may have multiple problems that affect all different organ systems, and you need a doctor who's able to manage all of those simultaneously.
Everyone from the PCTs, the environmental specialist that cleaned my room, he's one of our community hires. It was great to see him in action. Everyone made such a huge difference for me while I was in the hospital. I was in the hospital for 11 days. I spent my 40th birthday in the hospital. It was very disappointing to me to not only be in the hospital, but just dealing with what I was dealing with.
It was very hard to tell her that she was going to have to stay in the hospital for her birthday. She handled it with grace, but I know that really was hard for her. I texted my husband, "Please, can you find a healthy cupcake?" And I got home and he's like, there's no such thing as a healthy cupcake, Celine. Which he's got a point, but he did make sure that he tried.
I was so happy that Dr. Getz got her husband to get me that cupcake. She was very thoughtful of me on my birthday. There was music therapy while I was in the hospital. That was very impactful for me. I'm a songbird. She sang happy birthday to me. It really touched my heart. A lot of times we just want to be considered. We want someone to celebrate us. And that showed me she's not only a medical professional, but looking to go that, excellence is just the beginning.
It was a real joy to take care of someone who works for the institution, especially since she does work that is so important to our mission and to our service to our community. Having said that, I would have taken care of all of my patients in the same way.
I know where I contracted COVID at. I'm not happy to say, but this is a realization that everyone needs to realize. I had went to a friend's 40th birthday celebration. Isn't that ironic? We were outside. We did have on masks at first, but as the night went on, everyone got a little lax, and we figured, hey, we're outside. I remember taking a picture with some friends, and maybe 4 days later, I had every symptom of COVID except for vomiting. Loss of smell, loss of taste, body aches, all of that.
A recent COVID infection, plus confined to your home, maybe not getting out and exercising, maybe because it's cold or just, maybe you're still having some shortness of breath from COVID. This is unfortunately when blood clots can form. So we're seeing a lot of people with and without COVID developing blood clots because they're just not getting around and getting enough activity. She's doing great. She is always such a positive person, and she has such a great attitude. Doing some testing to see about what's the status of the heart and lung function now. We may consider a low dose of a blood thinner just for a few more months, followed by rehabilitation as an outpatient, exercise, therapy, things like that. And then ultimately, should go on to live a normal, healthy life. I'm glad that she came in when she did, and I'm glad that our hospital and our teams here are equipped to deal with the latest and greatest technology and getting our patients the best outcomes possible.
I have 2 extended family members, 2 women that went to sleep and they passed away from blood clots. And I was going home to go to sleep. And Miss Audrey called me. She's my angel. We can't just pass each other by without, sometimes really taking a good look at your colleague or listening to your colleague and taking a step further to show some care and encouragement. You just need the basics to just make it, right? And just the support. And that goes a long way.